Morning, time to ask the doctor. Today we were talking about knee surgeries with Dr. Kenneth Bramlett. He's an orthopedic surgeon with Grandview Medical. He joins us now to talk about that, when it may be time for surgery. Good morning, Dr. Bramlett. Good to see you.
Good morning. How are we doing?
I will say that when we start talking about this topic here in the studio, several people start thinking about and you know, people do start having issues and wonder when it is time to have surgery. What do you tell folks?
Well, there's three major reasons to have surgery. And number one is pain, that you can't stand it. Two, instability that is affecting how you do your life. And three, that you really can't, perform your day-to-day activity, work, take care of your family, take care of your mother. Those are things that drive people to us. And that's our indications really to do anything that's invasive, for sure.
And do you worry about an age? I mean, is there a certain age that you try to avoid doing a reconstructive knee surgery and wait a while? Talk about that for a moment.
Well, the age orthopedic people start about age 10 and they go to age 95.
Wow.
That's the interesting thing about it. So you have to kind of be prepared to address somebody in their 15 to 30. They're usually some meniscus or an ACL, which we do, or then they get older than that, 35 to 45 to 50, they'll have needle compartmental disease. And they end up maybe with what is more like a unicompartmental arthritic replacement for just focal disease from an injury or trauma or something of that nature. And then over 65 to 65, you can go all the way into the world of, major reconstruction or debridement, or something that's more totally orientated, which, you have to address it. And what your goal is to preserve as much natural bone as possible through each operative process. So the younger people, you want to be very conservative.
So one of my coworkers here, he's, I don't think he minds, he's in his 50s, and he's had several surgeries on his knees already. And he was just wondering, what is the latest surgery? And he had heard that maybe it's something that you can recover from a little bit quicker. What is the latest type of surgery for replacement surgery?
Well, I mean, we've been to an outpatient total knees for quite a while, and we built a surgery center which has facilitated that. I think the greatest change in the United States in the last 5 years is the advent of outpatient surgical procedures and outpatient surgical facilities. So we have built actually one in Vestavia for that purpose, and because it allows people a quick and easy access. COVID certainly precipitated more people to make that change because they want to avoid the large hospital complex. But minimally invasive surgery involves less muscle cutting, which we've advocated that for a long period of time, number one. Number two, getting people in better condition. So you run down their comorbidities. What are the things that can make their hospital stay more complicated, be it renal problems or history of blood clot or maybe cardiovascular issues that you need to clear up, atrial fib, things of that nature. So by clearing those things up and getting people in a better condition, which we have advocated also for years, a prehabilitative process as opposed to a rehabilitative process. So by prehabilitating a patient and getting them in better ideal condition, kind of like training for a 10K race, if you will, you're going to do better in the race. And so minimally invasive, outpatient, prehabilitative process, ideal conditioning of their comorbidities, all those make it a whole lot easier to manage the patient and their ability to get well that much quicker, for sure.
And because of that, I know every patient's probably different, right? There are things that are standard, but every patient will recover differently.
Oh, no question about it. I mean, everybody has their own VIP list, if you will. So that's the game that has to be played. Everybody has a different set of issues, and you have to adjust that. You standardize a customized process, if you will. Everyone's got a different set of comorbidities or none, or a different set of weight issues or none, physical condition or attributes of health that they've got, or just even the way they exercise and precipitate good surgery or bad surgery if they're doing things which are hurting themselves. It's a common problem.
Well, our viewers can see that we're on the screen. It says knee surgery for arthritis. Is that the most common reason why people have knee surgery?
Yeah, certainly so. I mean, once you get over 45 to 50, because of our high level activity and our young age these days, just do it population has just been doing it for 20 to 25 years. So now they have injuries that are sustained from high level sport, high level activity, not running per se, but just heavy engaged sport. So it's not uncommon to see people in 45 to 50 coming in with needle compartmental disease, long-term meniscal irritation, arthritic changes which are developing. So it's not you'll see a 50-year-old who maybe need a knee replacement or heavy active patients who have been healthy their life come in 85 years old, believe it or not, they want a knee replacement so they can still play tennis or still walk with their grandkids. I mean, so it's a great job to be able to see people and get them well in that capacity.
All right, we are out of time, but I do want you to give a quick answer to the viewers who may be thinking, a lot of people say, well, I'm just aging, that's why I'm hurting like I'm hurting. Is there a chance that you could have something that could be relatively easily fixed by not by going to a doctor?
Yeah, the idea is to be proactive about it, because you can let things kind of wind down and kind of miss opportunities for yourself. So we have an education process, called myorthopedicproblem.com that allows people to go and self-diagnose through artificial intelligence to walk through a sequence of ideas and diagnoses to kind of get a focal idea of how they can condition themselves and rehabilitate themselves, and then seek what's the best answer for their condition.
All right, what's that website again?
myorthopedicproblem.com.
myorthopedicproblem.com. Dr. Bramlett, thank you. Thanks so much.
My pleasure. Thank you, man.
All right, good to see you.